I want you to look at your hands right now. Look at the skin between your knuckles. Look at whether there are any small cuts or nicks that seem to be taking longer to close than they should. Think about the last time you had a minor wound, a paper cut, a scrape, and try to remember how long it took to fully heal. And while you are doing that, think about the last time you woke up in the middle of the night needing to use the bathroom. Not once, but whether it has become a pattern. 2, 3, maybe more times most nights. If any of this sounds familiar, I want to talk to you today about something that affects tens of millions of Americans over 60 who have never been diagnosed, never been tested, and who are walking around right now with blood sugar levels that are quietly damaging their kidneys, their nerves, their eyes, and their cardiovascular system. Today, I am going to give you the 7 warning signs of high blood sugar, signs that can appear years before a formal diabetes diagnosis, and signs that your body is sending right now whether or not you know to look for them. My name is Dr. James Harlow. I have spent over 25 years in internal medicine, and one of the most consistent clinical patterns I have observed is that type 2 diabetes and prediabetes are diagnosed late, often 5 to 10 years after blood sugar has already been elevated enough to cause damage. The warning signs exist during that entire window. Most people simply were not told what to look for. If you are not yet subscribed to this channel, please do that now. Every week I publish videos that give you the clinical education your appointments rarely have time for. Subscribe and ring the notification bell so you never miss one. Before I walk you through the 7 signs, I want to give you a number that matters. The American Diabetes Association Standards of Care, published in 2026, found that nearly 50% of adults over 65 in the United States have either diabetes or prediabetes, and approximately 1 in 4 of those with diabetes does not know they have it. That is not a small number. That is the person sitting next to you in the waiting room. That may be you. Let us go through what your body looks like when blood sugar is too high. Warning sign number 7 is increased urination, especially at night. When blood glucose levels exceed the kidney's reabsorption threshold, approximately 180 milligrams per deciliter, glucose spills into the urine. To excrete this glucose, the kidneys require water, and they pull it from surrounding tissues. This osmotic effect produces large volumes of dilute, glucose-rich urine. You urinate frequently during the day. You wake up 1, 2, 3 times at night needing to go. You may have attributed this to an aging bladder, to drinking more before bed, or to a prostate issue if you are male. All of those are possible explanations. But if nocturia, nighttime urination, is persistent and accompanied by any of the other signs I am about to describe, blood sugar deserves to be investigated. Warning sign number 6 is increased thirst that does not resolve normally. This is the direct consequence of the fluid loss I just described. As your kidneys extract water to carry glucose out of the body, your blood becomes more concentrated. Your brain detects this change and triggers thirst as a compensatory response. The problem is that after 60, the thirst mechanism is already blunted, meaning that by the time you feel genuinely thirsty in the context of elevated blood sugar, the fluid deficit is often substantial. Many patients describe it as a thirst they cannot quite satisfy, particularly in the afternoon and evening. If you find yourself drinking unusually large amounts of fluid without feeling hydrated, that pattern warrants attention. Warning sign number 5 is blurry vision that comes and goes. The lens of the eye is highly sensitive to changes in fluid balance and osmotic pressure. When blood glucose rises, water is pulled into and out of the lens by osmotic forces, temporarily changing its shape and refractive properties. This produces intermittent blurry vision, not a constant blur, but a fluctuating one. It may be better in the morning and worse in the afternoon. It may seem to correlate with meals. Many patients in this age group attribute this to age-related vision changes or cataracts, and those are certainly possible. But fluctuating blur that correlates with meals or time of day is a red flag for glucose-related lens changes and warrants both an ophthalmology evaluation and a blood sugar test. Warning sign number 4 is fatigue after eating. This is different from general tiredness. It is a specific pattern. You eat a meal, and within 30 to 60 minutes you feel an overwhelming heaviness, a need to sit or lie down, a mental fog. What is happening physiologically is a pronounced post-meal blood sugar spike, followed by a compensatory insulin response that may overshoot, producing reactive hypoglycemia. The cells of your body are flooded with glucose but may be insulin resistant, meaning they cannot use it efficiently, so you feel sluggish and fatigued, even though your blood is full of energy it cannot access. This pattern, documented extensively in research on insulin resistance in the Journal of Clinical Endocrinology and Metabolism, is one of the earliest functional signs of impaired glucose metabolism, often appearing years before fasting blood sugar becomes abnormal on a standard test. Warning sign number 3 is slow healing wounds and cuts. This is the sign you looked for at the beginning of this video. When blood glucose is chronically elevated, it impairs function in several key wound healing systems simultaneously. It reduces the activity of white blood cells that fight infection at the wound site. It damages small blood vessels, capillaries, that deliver oxygen and nutrients to healing tissue. And it creates a biochemical environment that promotes bacterial growth. The result is that small cuts, abrasions, and skin irritations that would resolve in a few days for someone with normal blood sugar can persist for weeks in someone with uncontrolled glucose. This sign is particularly important to monitor on the feet, where circulation is already reduced in many older adults, and where wounds can progress to infections with serious consequences. Warning sign number 2 is frequent infections, urinary, skin, or otherwise. High blood sugar creates an environment that bacteria and fungi thrive in. The immune response that normally identifies and eliminates pathogens is suppressed by chronically elevated glucose. This is why adults with poorly controlled blood sugar tend to get urinary tract infections more frequently, why fungal skin infections are more common in skin folds, and why respiratory infections can become more severe. Research published in Clinical Infectious Diseases found that patients with newly diagnosed diabetes reported significantly higher rates of infection in the 2 years preceding their diagnosis compared to age-matched controls, suggesting that immune dysfunction precedes the formal diagnosis by years. If you or someone you know has been dealing with recurrent infections of any kind, blood sugar should be on the evaluation checklist. Warning sign number 1, the sign I consider most under-recognized in this age group, is tingling, numbness, or a burning sensation in the feet or lower legs. The nerves that serve the extremities are among the first to be damaged by chronically elevated blood sugar in a process called peripheral neuropathy. These nerves are long, thin, and metabolically demanding, and they are exquisitely sensitive to the toxic effects of glucose and the reduced blood flow that comes with damaged small vessels. The result is a range of sensory disturbances: tingling, pins and needles, burning pain, or numbness, often starting in the toes and feet and progressing upward. A systematic review published in Diabetes Care found that peripheral neuropathy is present in approximately 50% of people with type 2 diabetes and in a meaningful percentage of those with prediabetes who have never been diagnosed. By the time neuropathy is advanced, it may not be fully reversible, but catching it early, at the stage of mild tingling, gives you the opportunity to intervene before permanent nerve damage occurs. I want to pause here. If you recognize 2, 3, or more of these signs in yourself or in someone you care about, I want you to leave a comment below telling me which ones you identified. You do not need to share personal health details. Just let me know what resonated. I read every single comment on this channel. Let me now address who is most at risk. Adults over 60 with a family history of diabetes, those who are overweight, particularly around the abdomen, those with a history of high triglycerides or low HDL cholesterol, women who had gestational diabetes, and those who have been sedentary for extended periods are all at elevated risk for undiagnosed prediabetes or type 2 diabetes. Interestingly, people of normal body weight can still have significantly impaired glucose metabolism, particularly after 60, because insulin resistance can develop independent of weight as a consequence of reduced muscle mass and other metabolic changes that accompany aging. Here is your action protocol. Step 1. Ask your doctor for a fasting glucose and HbA1c test at your next visit. The fasting glucose tells you your blood sugar at a single point in time. The HbA1c tells you the average blood sugar over the past 3 months. Both together give a much more complete picture than either alone. Step 2. Ask about a 2-hour glucose tolerance test if your fasting glucose is normal, but your symptoms are persistent. Many people with impaired glucose tolerance have normal fasting glucose, but abnormal post-meal responses, and a standard fasting test will miss them. Step 3. Reduce refined carbohydrates at breakfast specifically. The morning meal has the most significant influence on your blood sugar trajectory for the rest of the day. A breakfast built around protein and healthy fat, eggs, nuts, avocado, produces a dramatically different glucose response than one built around cereal, bread, or juice. Step 4. Walk after meals. Even a 10-minute walk after eating activates muscle glucose uptake and measurably reduces post-meal blood sugar spikes. This is one of the most well-supported lifestyle interventions in diabetes research, and it costs nothing. Step 5. Have your feet examined at every doctor's visit. Ask your physician to check your sensation in the feet using a simple monofilament test. Early detection of neuropathic changes is one of the most important steps in preventing the foot complications that are the leading cause of non-traumatic lower limb amputations in this country. If this video gave you something worth sharing, please send it today to someone you care about. Subscribe to this channel and leave a comment below telling me whether you have ever been screened for prediabetes or whether any of these 7 signs have been present in your life. I read every one. I am Dr. James Harlow. Take care of your blood sugar. The damage it does is silent until it is not. I will see you in the next video.